the big slot in the machine. There's usually a very big slot, it's very obvious. The pads are sticky. We're not going to stick it to the mannequin, but imagine I take it off. This is sticky. Stick it to the skin of the person, please. Okay? Take the shirt off, rip it off, cut it off, or pull it up. It needs to be on the skin because the electric shock needs to go to the heart. It doesn't need to go to the shirt or the jacket. Okay? One on the front, one on the side. This would be off. It would be on the side. Okay? Either on this side or on that side. It doesn't matter. Okay? Doesn't matter. The idea is that it's easy. Okay, so this is now saying that it's connected. It will start talking to you. Stand clear. Stop touching the person.
Analyzing now.
It's going to analyze the rhythm. You're still not allowed to touch the person. It thinks there's a shock coming, so it's making a very loud noise. The machine is charging, it's getting ready to do an electric shock. Okay? The whole idea is, be careful, there's an electric shock coming, do not touch this person. Press the shock button, there's a red button over here, other ones, usually it's a red big button, press the button, shock has been delivered.
Start CPR.
Back to CPR. Just because a shock is done does not mean you stop. Okay? Alright.
And leave the pads there.
Leave the pads on.
So you have to wait for the machine to tell you to do the CPR.
Exactly. It will do that cycle every 2 minutes. Every 2 minutes it will check the rhythm. It will either tell you there's a shock that you can give or there is no shock that you can give. Either way you continue CPR. The only time you stop CPR is health comes for you.
Okay.
You are tired. But you cannot help someone if you're tired. If you are in danger, you need to stop it, protect yourselves. It's really important and I really mean it. Okay? If an animal comes towards you, you've got to step away. If there's an electrical wire that suddenly falls, step away. If you're in the middle of a road and traffic comes, I want you to walk away. Okay? If it is raining and you're getting soaked and are at risk of becoming hypothermic, you do not need to be there. You need to protect yourself. Okay? Other reason to stop? He wakes up. Alright? Or starts breathing. That's the time to stop CPR. But if the ambulance guys come, they will usually come and say, thank you very much for your help, we'll take over. And then you stop. Does that make sense?
Doc, excuse me, Doc. How about the baby dog is allowed to use this manner?
Some of them are allowed for pediatrics. Not all of them, unfortunately.
Design or smaller one.
So some of the machines have a setting for pediatrics, but I don't think any machine is allowed for infants. So if it's a baby of less than 2 years old, I would just do CPR. The biggest thing for a baby is help. They need to be in a hospital. Okay? For a child, some AEDs, I think in Westfield, for example, have a pediatric setting. There's a very big button which says pediatric. Yes, which is smaller, basically, for the pediatric chest. But I would probably say if you're unsure, if they're big enough, if they're a teenager, you can use an adult pad. If they're an adult, use an adult pad. If they're a child, if you're unsure, just don't use it, just do CPR. Makes it easy. Okay? If that's all right, I'll go to the next one.
Yeah, thank you. Two buttons, green and red. Turn it on.
Thank you, Sari. Thank you.